So, morning Brendan, if you could introduce yourself please.
Good morning, Shaun. My name's Brendan. I'm the clinical service lead for CAS, a paramedic by clinical background. Started in health probably 17, 18 years ago. And my first health job was in a local care home in Lincoln, so CAS for Care Homes project is something that's really close to my heart personally.
Why should care homes use Whzan when calling CAS?
I think it's really important for care homes to use Whzan because it gives us a head start. So it allows us to get the baseline of a patient immediately at the port of call. It saves time and it helps with spotting early deterioration and ensuring that the patient is given the right pathway via CAS.
When should care home staff call CAS?
So I guess we just want care home staff to call CAS whenever they're worried about a patient being acutely unwell. So earlier is better, so don't leave it too late because the chances are if the deterioration goes further, then that results in potential EMAS or hospital admission. So as early as possible when they notice an issue with the patient.
So from CAS's perspective, how important is Whzan in supporting care homes for both residents and staff?
Yeah, I think it's vitally important, honestly, because the ability to have a baseline for a patient is really, really important. Even more importantly, from a CAS point of view, is having that extra knowledge about a patient via their observations to inform a clinical decision. So if we're not getting observations, it might sway the decision. So if a patient's unwell, we didn't have observations, it might be if we're basing it just on clinical presentation, that means hospital is non-avoidable. But there's a chance that if we have observations to back the clinical presentation, then the pathway might be different.
So going forward, would CAS potentially use the camera part for photos or the video calling part?
The photo bit for me is quite key as well. So at the moment we take photos from all of our other patients, the patients that are able to send them in via the System 1 communications annex. So we send them a link, they send a picture back via that link. It's not necessarily available to care home patients because it has to go to an individual mobile. So what Whzan does is, allow equity for those care home patients to be able to send us a photo if they've got a presentation that perhaps would benefit us from seeing, then we can do that via the Whzan.
How does Whzan help to strengthen relationships between system partners and care homes?
I think Whzan as a piece of kit has really helped me personally. I think first of all, I have to mention the relationship we've built with yourselves at LinCA. I think that's really key in this. I think the links between CAS and LinCA and Whzan are really key to support with care home patients. I think Whzan not only supports us as a trio, but also PCNs are able to see baselines, or anyone else involved with the patient care would be able to see baselines and support. Working together is what matters for me, and working together for the care home residents, Whzan brings that all together, and I think we're seeing a meteoric rise in the uptake of Whzan and the use of Whzan. And I think, like I said, last year we called 20,000-ish care home residents, and if we were able to have 20,000 observations from those residents, that nearly 80% is certainly going to increase.
So lastly, what advice would you give to care homes who aren't currently using Whzan?
I would say, give it a go, give it a chance, because, and appreciate it doesn't work for everybody, but with everybody now on board, it's going to be different to what it was before. So if we're talking 2-3 years ago when Whzan was, for me, just a piece of kit and didn't have a lot of backing and support from other areas, that's changed now. So I think, give it a go. It will 100% benefit the residents. There's no long and short of it. There's data there to prove that. If you, as a care home provider, are, want to improve your residents' life, then Whzan will do that. If everybody wants their patients to be comfortable and get the right care at the right place at the right time, and a majority of the time that is at home. Yet we ask every single care home resident that comes through onto CAS for a range of observations. So why wouldn't we use the kit at our disposal, the kit that also allows for us to, you know, track trends, allows for us to track deterioration. You might have a bunch of this just on the side that isn't a Whzan box, but what this bit does is, you know, allows to support that patient even further. Thank you for
A
having
massive
me.
thank you for your time, Brendan, and thanks for coming in.
Not a problem, thank you.
Thank you very much, mate.
Cheers, mate.